Hi, all. Thanks so much for joining. Speaking of making healthcare work for you, different perspectives and empowering solutions. I'm Stephanie Fields, joined by my co-host, Dr. Apoorv Gupta, and we're talking about our interview with Marianne Fazen, who is the president and CEO of the Texas Business Group on Health and the executive director of the Dallas-Fort Worth Business Group on Health. Now, it was great because she was talking about a grant that they're participating in that they received, and they're handling the depression trying to improve depression outcomes. She says it much more eloquently than I did, but it's a 3-year program that they're using grant money, and they're working with large employers within the Dallas-Fort Worth area to reduce depression overall by decreasing the stigma, increasing the access, trying to work with primary care providers to get them to do a depression questionnaire by utilizing employee resource groups, EAPs, which I was so surprised that she said that EAPs have about an 8 to 10% utilization, which is nuts because those really are employee assistance programs. They're great. And you can get usually free mental health care within that for a certain number of counseling sessions. But because they're not using them, she said they're really focusing on trying to get people to use them. And then she was also talking about the importance of telehealth. And that is really beneficial because the group that she said is most impacted by the increase in depression since the start of COVID is the millennials who are very comfortable with doing everything. And she suggested putting the depression questionnaire on the Apple Watch, which I love because that certainly would be ease of use and access. But they're working on so many things. And I love how they're just working from a 360 perspective to tackle all of these different things. And it's not easy to get people to admit that they might have an issue because it's probably all, aside from being scary, you don't want to tell other people, it impacts your regular life. So I love the program that they're working on. I think it's going to be a huge success. Apoorv, what did you think about it?
Thanks, Stephanie. I think she actually brings it all together for me as well. She's connecting the dots that we're hearing about COVID. We're hearing about the impact that COVID has made on the workforce. We're hearing about employers struggling to find enough employees in sector after sector, certainly in my industry, in healthcare. We hear client after client being concerned about finding enough nurses, finding enough techs, finding enough physical therapists. They're just like discipline after discipline. It's really been challenging. And what I haven't understood is the toll that anxiety and depression is playing in that mix. And that's what I think she really turns a light on. Employers are now starting to see, I guess they've been focused on this for some time, but after COVID, they've particularly started to feel the impact of their workforce that is very anxious about coming back to work. They're afraid about the exposure. They're afraid about returning to a routine. It's a really, really challenging time. It's not just business as usual. And now that COVID may be ending, we're just going to go back to the way it used to be. Lives have changed. People have changed. People's psychologies have changed. And that's what I think they're recognizing. So it's amazing what Marianne and the Texas Business Group for Health is trying to do to bring all of the key players together, the payers, as well as health systems, and obviously the large employers, and try to figure out how can we create a toolkit to make people more aware of what's going on with depression and anxiety, and try to make them, either improve their awareness of what's going on, and be the first step in trying to get them some help. So I'm really excited about hearing about what the group is working on, and I feel our audience is going to learn a lot about why suddenly this is becoming such a big issue for employers.
Absolutely. She really just shed so much light on a lot of different things that employers are dealing with. So be sure to check out the interview and we'll talk to you soon. Bye-bye.